Hi, how are you, everybody? My name is Bill Rice. I'm a thoracic oncologist in Miami, Florida. I'm here to talk briefly about the importance of molecular testing. And nowadays, we have different genetic aberrations that we have discovered in the lung cancer, and we have been developing new treatments for each of these genetic mutations or genetic aberrations, to the point that we have now 10 genes that we can target with oral therapy. For that reason, it's very important to every new patient with lung cancer to be tested for one of these genetic aberrations, because we can avoid to go straight for chemotherapy. Maybe he can have an oral therapy, what we call target therapy. And this genetic testing is done in the tumor that we have obtained from the biopsy or for surgery. Also, the genetic testing can be done in the blood. There is no one better than the other. Actually, they are complementary. And so that's why if your doctor has a possibility to order the liquid biopsy, the blood testing, or the tissue testing, it's important to do both if it's possible. Usually we have to wait 2 or 3 weeks for the results. That's why you have to be very patient. I know that it's terrible to have a diagnosis of lung cancer and other doctors tell you, hey, we cannot start therapy, we have to wait. But it's important to wait because we can find maybe the patient has a genetic aberration and the patient may be a candidate for oral therapy that can be discovered for this tissue testing or blood testing. And that's why it's important to do this test. It's part of the standard of care in any new lung cancer patient to have now genetic testing. This cannot be avoided. And then the patient will be a candidate for a target therapy if we do the genetic testing. In the United States, the genetic testing is covered for most of the insurance. That should not be a problem. Also, there is a lot of help if insurance doesn't cover, or the patient doesn't have insurance. There is patient assistance programs for several companies that do the genetic testing. Only the doctor has to sign a one-page document, and then you probably can have help and access to genetic testing. It's very important to do the genetic testing. Please don't give up on that. It can make a very big difference in the survival of the patient. Sometimes these oral therapies that we discover with genetic testing can work for 2, 3, or 4 years before even we start palliative chemotherapy. Thank you very much for your attention.